Brought to you by Dr. Joe Ordia. Frequently asked questions about neurosurgery and pain management. Questions 31 to 35. Nutrition and brain health. I start with a disclaimer. The opinions expressed here are for general information and based on my own professional experience. They are not intended to replace the advice of your healthcare provider on your particular condition.
Question number 31. My aunt is a dietitian and she frequently reminds us to eat nutritious food to keep our bodies and brain healthy. She has ties to both New York and Boston, and our family often echoes her advice with the phrase, "Eat your apple, and your baked beans." How does nutrition affect the brain and pain?
Answer: your aunt is absolutely correct. Nutrition plays an important role in maintaining brain health and pain perception. Hippocrates, 460 to 370 BC, who lived more than 2,000 years ago and is considered to be the father of Western medicine, is most famous for the Hippocratic Oath. He has another notable saying, quote, "If you want to learn about the health of a population, look at the air they breathe, the water they drink, and the places where they live," unquote, emphasizing hygiene and diet. Nutrition provides biochemical information that directly affects neural signaling, inflammation, neurotransmitter production, and the sensitivity of pain pathways. Inflammatory processes in the brain and spinal cord play a central role in many chronic pain disorders, including neuropathic pain, fibromyalgia, and migraine. Nutrients that promote overall health by exerting anti-inflammatory effects are likely to help reduce pain. The production of neurotransmitters is influenced by nutritional ingredients. Mood-enhancing and pain-reducing neurotransmitters, like serotonin, is synthesized from the essential amino acid tryptophan, while norepinephrine and dopamine are produced from the dietary amino acid tyrosine. Both amino acids are affected by dietary intake, particularly proteins. Foods that are high in both tryptophan and tyrosine include plant-based sources like soybeans, beans, tofu, lentils, peanuts, almonds, cashews, and oats. Animal-based sources include salmon, tuna, chicken, turkey, eggs, milk, cheese, yogurt, beef, and pork. Your reference to apples brings to mind the well-known adage, quote, "An apple a day keeps the doctor away," unquote. Apple contains anti-inflammatory oxidants, vitamin C, and prebiotic fiber, which support the brain and reduce pain. It also helps to maintain a steady blood sugar level and to avoid spikes, which can exacerbate pain perception. Feel free to eat an apple a day, but don't keep the doctor away. Attending scheduled wellness appointments is one of the most important steps you can take to safeguard your health. Another note of caution. We talked about foods that support brain health, but they may lose much of their value when over-processed or formulated with excessive additives and dyes. When shopping, taking a moment to review the ingredient label can make a meaningful difference. Be cautious of products containing high levels of added sugars, sodium, calories, or hydrogenated fats. These dietary habits continue to fuel the worldwide challenges of diabetes, hypertension, and obesity. Assessment of dietary patterns and provision of nutritional counseling should be incorporated not only into pain management, but also across broader healthcare practices.
Question number 32. In another conversation, you described the connection between the brain and the eyes. Is there a similar link between the brain and the bowel?
Answer: the brain-gut axis is the neural network through which the brain and gastrointestinal system communicate. After the brain, the most nerve cells in the body reside in the gastrointestinal system. Acting through the network, diet can alter the collection of gut microorganisms known as microbiota, which contribute to the production of tryptophan and influence neurotransmission, inflammation, pain sensitivity, and behavior. Diets rich in high-fiber plant foods that provide prebiotics, such as asparagus, garlic, and apples, along with probiotic-containing fermented foods like yogurt, help to promote good gut bacteria like lactobacillus, which reduce inflammation and pain. Other anti-inflammatory diets include polyphenol-rich foods like berries, apples, cherries, beans, pecans, cocoa, and dark chocolate. Omega-3 containing foods such as soy, flaxseed, and walnuts also exhibit anti-inflammatory properties. Intake of fatty fish such as salmon and mackerel is typically recommended to be limited to 2 servings per week, totaling not more than 12 ounces for adults, due to the risk of contaminants including mercury. While often dismissed as merely a figure of speech, the term gut feeling is the result of the coordinated signaling which arises from the brain and gut brainstorming together.
Question number 33. Are there dietary supplements that can help alleviate pain?
Answer. Turmeric belongs to the ginger family and has anti-inflammatory properties that aid in reducing pain. It is available as a spice, tea, pastille, or as a capsule. Its active compound is curcumin. Ginger can also reduce muscle pain. The anti-inflammatory attributes of omega-3 fatty acids, fish oil supplements, and magnesium have the potential to reduce pain. Vitamin B12 deficiency is a known cause of peripheral neuropathy which can be painful. Calcium, vitamin D, magnesium, and zinc all play a role in supporting bone metabolism and strength. Adequate amounts in a balanced diet or as supplements might offer protection against osteoporosis and painful vertebral compression fractures, which can significantly impact one's quality of life. Avoidance of unhealthy diet, over-processed food, obesity, and smoking can also lead to a reduction in inflammatory pain. A false sense of security may arise that dietary supplements are universally safe because they are not generally regulated. It is advisable to discuss with your healthcare professional before starting a dietary supplement, as there may be potential adverse reactions or interaction with other medications. It is important to keep in mind that regular exercise plays a vital role in maintaining overall well-being and reducing pain.
Question number 34. I had dinner with my friend the other day, and she told me that she heard that the hot pepper habanero is used to treat some types of pain. Is this something that we do in the US? Gracias, doctor.
Answer. Gracias, señora. Thank you, ma'am. Habanero is the Spanish name for one of the hottest varieties of chili pepper. Because of its intense flavor, it is a staple in spicy cuisine. It contains the chemical called capsaicin, which can relieve neuropathic pain, muscle pain, and arthritis or joint pain when applied topically to the skin. It binds to the nerve endings, initially causing a burning sensation. Then it desensitizes nerve and blocks the transmission of pain. Therapeutic capsaicin preparations are presently available in 2 forms, creams and patches. The cream has a maximum concentration of 0.1% and can be obtained over the counter. Contact with the eyes or open wounds should be avoided, as it can cause serious irritation, burning, and pain. The hands must be thoroughly washed after application. The prescription-only 8% patch is indicated for the treatment of postherpetic neuralgia, which can follow an attack of shingles, and diabetic neuropathy of the feet. It is to be administered only by a trained healthcare professional using appropriate gloves and eye protection. Given that the patch can be very painful, the skin is pre-treated with a local anesthetic cream such as lidocaine or lidocaine prilocaine, EMLA. The therapy may not be appropriate for you if your blood pressure is uncontrollably high. The treating professional removes the patch targeting postherpetic pain after 60 minutes, while that for diabetic neuropathy is removed after 30 minutes. If the treatment is successful and provides some pain relief, the application can be repeated every 3 months if clinically indicated.
Question number 35. I understand that malnutrition negatively affects dental health. What brain-related problems are associated with poor oral hygiene?
Answer. Poor oral hygiene resulting in tooth decay and dental caries poses a risk for potential brain-related problems from the entry of oral bacteria into the bloodstream, potentially reaching the brain and other organs. The migration of bacteria to the membranes covering the brain can result in meningitis, or it can extend further to the brain itself, leading to the formation of a brain abscess. Various forms of spinal abscesses can also occur. The entry of bacteria into the bloodstream increases the likelihood of blood clot formation, cerebral embolism, and stroke. Individuals with dementia and Alzheimer's disease frequently exhibit poor oral hygiene, often characterized by gum disease, also referred to as periodontitis, and tooth loss. This condition arises from inconsistent brushing habits and inadequate oral care practices. Attending to the oral care requirements of these individuals will not only enhance dental hygiene, but also mitigate associated risk factors, consequently enhancing their overall health and well-being.